Welcome everybody. It's Wednesday, January 15th. Wednesday, January 15th, 2020. Happy New Year to everyone. I hope you had a wonderful holiday season and that you're ready for this new year, because this year is going to be really amazing and something, regardless of whether you're pregnant, having children, getting new businesses, moving homes, whatever it is, it's going to be something special. So I'm Colleen Joy. I'm a licensed midwife and a certified pediatric massage therapist and a certified professional midwife. And I'm excited always to come and talk to you on Wednesday nights. I've had the opportunity to be in contact with some of you by email. And my email is my name, KoleenJoyMidwife@gmail.com. You're welcome to message me if you don't know how to spell my name. And it's been really fun. I've shared my supplement lists with you. I've gotten to answer some questions, and it's been fun to interact with some of you. And thank you for watching and for your sweet comments. All right, well, tonight is a hot topic. It always has been, and in midwifery, it's always a topic that we have to talk to families about. When you're planning to have a baby, or maybe someone in your family is, whether you're having a boy or a girl, there's discussions with parenting. How will we parent? Where will we birth? Who will we birth with? Do we want this? Do we want that? The nursery has to be decided. And parenting comes with so many decisions that it's amazing. And it never really stops, because learning how to raise those children comes with decisions over and over and over again. Well, tonight we're going to talk about intact versus circumcision and choosing for your child what's best for them. Now, the reason I say this is a really hot and challenging topic is because it comes with a lot of controversy. And some of the controversy can be in a relationship between the parents. Maybe one parent has a bigger preference than the other one. Perhaps maybe it's because they may be circumcised, or they may not be circumcised, or they may be parents of the same gender, and one is, one isn't, or two females. And we have a discussion about that tonight too. So one thing I want to say as we get started is we're talking about gender. And right now in our world, we want to be very sensitive to the fact that boys, girls, and that some do not identify as a boy or a girl. And although some also may have what we would classically say is a girl anatomy, they may not identify as a girl. So what I am going to do is just ask you to let me, because of my upbringing, I'm very sensitive to this, and I want to say that this is for anyone, regardless of this, that we have parents who have vaginas and clitorises, and we have parents who have penises and scrotums and testes. But for the simplicity of talking about this, you're going to hear me use the terminologies boys and girls as they relate to vaginas and penises. So just know that I am being sensitive, that there may be people watching now or that may watch it recorded that may or may not identify with how I'm using that. Now, starting off, whether you're pregnant now or whether you've already had children, if you've had children, you may have a boy, you may have a girl, you might have a mixture of kids. And when you're pregnant, it's all about, enjoying and hoping for this baby to be strong and healthy, and going forward in your pregnancy to planning a birth that is something that you can really be proud of and thankful for, and that you welcome your baby into your arms with celebration and with gratitude. And what happens when a baby is born? Now think about this for a moment. When any baby, whether you knew it was a boy or you knew it was a girl beforehand, or you didn't know at all, or you don't identify them as a gender specifically, what are you looking for when your babies are first born? You're looking to see that they're healthy, right? The first thing is like, wow, are you well? Are you healthy? Let me count those fingers. Let me count your toes. Let me see how the swirl on your head does. Let me look into your eyes. Let me look at that chubby little body or tiny little body, depending on the size and how your babies are born. And we're looking at the health and well-being of the baby. And we're looking at who they are. And we're falling in love with them and memorizing them with our eyes, our ears, our sense of touch and smell. We're enveloping this baby that has been born, that has been in this beautiful womb home for all these months, growing every little part of them so that they can come out here and work well. So we want their hearts to function well. We want them to be able to see. We want them to be able to hear. We want them to be able to walk and talk. And we want their kidneys to work well, their gallbladders to work well, their pancreases, their stomach. We want their all of their anatomy to work well, right? So when those babies come out, one of the things that is in a baby that doesn't have some type of an issue, okay? And we're taking into account that some babies may have genital issues because of where things are placed, or there may have been something that just didn't form quite right. In the same way that we have babies with tongue ties and lip ties. It's not the first thing that you go, oh, do they have a lip tie? Oh no, they have a lip tie. Okay? Same way as you probably don't go looking at their penis and say, oh, do they have a hypospadias? For anybody who's had that, that's where the opening of the meatus, where it should come out, it comes out above or below where it's supposed to. In other words, it formed in a little different place. So we don't go looking for that first thing, right? Any more than we go looking for tongue ties or lip ties or anything else. We explore them and we say, wow, you're so beautiful. And what we know is that you have an opportunity to see a baby girl and see a baby boy, how they were born. This week to keep that cough away. All right. So what we look at is, wow, you're amazing. We see everything that's perfect and whole on them. So barring that there isn't something that anatomically did not form correctly, assuming that everything formed correctly, we diaper them, right? And we change their diaper and we wipe and we do what we need to do. So let's talk about baby girls for a minute. Now, a baby girl has an anus like a baby boy. That's where their poop comes out, right? A baby girl has a vagina, obviously, which is what leads into where that beautiful womb home is, where babies come through. And then they have a urethra, and males have a urethra on their penis. And baby girls have a sort of hood or labia that continues to develop, right, as they mature and they grow into teenagehood. And but it's there and it's protecting. And it's protecting them from infection. Let's see how long I can talk tonight, or how short I can talk. It's protecting them from infection because it acts as a covering, a protection. It protects them from getting rubbed on diapers, underwear, clothes as they grow, bicycles, gymnastics, or whatever they happen to be doing. It adds as a protection to the clitoris that's up underneath, right? And that clitoris is extremely sensitive, right? Well, so that the hood, or the hood that's over it, helps to protect that so that it doesn't become desensitized, it doesn't become oversensitized, that there is no infection, and that it is protected. And so as a girl, that is put over there. Now, where is that? Because we know that we're definitely gender neutral in our anatomy early on in when we're just forming. Okay, everything looks the same until there are certain hormone washes and various things like that that begin us growing into either what we term as a female or what we term as a male. So during that time, males begin to grow the foreskin, and the foreskin grows up and over the glands, and it acts as a protection from infection, from desensitization, from getting oversensitized, and from being rubbed on clothing, on diapers, on bicycles, on whatever it is that it may come in contact with, and especially with males, because theirs is much more out of their bodies, that covering is very important to the glands, which is a lot like that tissue that you would find inside that labia where the clitoris is and where your urethra is, which is where you pee. So it's how we both developed, right? Males and females. So when we look at circumcising a girl, that would be to take that hood off. And what would be there would be very fresh skin, and the clitoris would be very exposed all the time. Now, in a male who comes into the world, you birth a little boy, and this little boy has a covering. And sometimes it looks a little wrinkly because it has to have little erections, because even baby boys in utero, even newborns, have little erections. And it's part of their anatomy. They get stimulated, they need to pee, the little erection comes. Part of that is the growing process that helps with that foreskin. And especially as time goes on and the foreskin is left intact instead of removed, what happens is that those little erections and, of course, the curiosity of a young boy, it causes it to start softening, and the normal growth and development begins the separation of that foreskin from the glands. Because prior to that, when there's a lot of beads of what they call smegma, right, that start causing a lot of mucus between the glands and the covering over it, that begins to start allowing it to separate and to have some gliding and some motion. And then with an erection, it little by little over time, 3 to 10 years, begins to videos saved to your stories for 24 hours there. Yes. So these videos on Instagram are saved for 24 hours. On the Natural Childbirth 101 Facebook page, they're saved, I guess, forever. And I do try and put these up on YouTube as well. So we know that as they grow, it begins to stretch and stretch and stretch until it can be retracted back over the glands. Now, a little baby boy, I'm so sorry, everybody. So, a little baby boy, when they're first born, and then if they stay intact, how do you care for them? All you have to do is wash like you would a finger. Don't do anything to it. Just wash, rinse, and repeat. That's it. That's all you have to do. So with a circumcised baby boy, there is some things that you have to do following the surgery, and that would be I don't know, it may get cut short tonight. Following the surgery, you have to put gauze and an ointment on it, and the gauze is to protect it from getting rubbed, because the hood that now has been exposed is kind of somewhat raw, and it needs time to heal over and become a little more calloused so that it can be in the outside air, as if you had scraped off all this skin and it had to sort of build a new layer in order to protect your hand, okay? So when that foreskin is taken off and you use the gauze and the ointment to keep it from sticking onto that, eventually it will heal over. But the foreskin that was taken off is actually doubled up. So it comes like this, but it's taken off from here, everything's backwards, from here around, okay? Which means that what you see is actually double because it's folded in half. So that comes off, and the area where it was cut from here has to either heal the two little parts together, or it heals some skin over, and it then creates a shorter shaft. The inside is not shorter, so when it pushes up, it will have to grow that a little bit, because that's not the way it was made. But taking care of it, wash, rinse, and repeat. That's all it takes. So whether they're circumcised or whether they're not, it's wash, rinse, and repeat. That's it. Now, a non-circumcised and intact baby boy later in life is taught to just pull the foreskin back, wash and rinse, and put it back together. It's as simple as that. And you know what? They're as used to it as we are our ears, our nose, our lips, our tongues. This is part of their body anatomy. They're used to it. Trying not to cough into the mic. So, the questions that you have to be able to ask yourself. Now, some of you may have had baby boys and went ahead and circumcised already. The question is, why? Was it your preference by the way it looks? Was it your preference because that's what people do in your family? Was it the preference of your partner because that's what they look like, or because people were teased and they don't want their child teased? So you have to be able to ask why. And even being intact, why? Why do you want to leave a baby boy intact? Now, many times it's, well, it just makes sense. Why would I take something off of them that functions and nothing's wrong with it, other than the ideas and the opinions and the perception of how we view things in life. Now, if you've already had boys and you've already circumcised and you're comfortable with that decision, then be comfortable with that decision because you understand and you have the knowledge of why you did it. The question you have to ask for future babies is, do I want to circumcise future baby boys? Or perhaps you don't know you're having boys yet, and it's a discussion that has to occur, which is why I do these, to help give you some understanding of perhaps ideas and concepts that maybe you wouldn't ordinarily walk into. Asking an obstetrician, asking a pediatrician, they're only going to give you what their opinion is, right? If you ask your parents, they're going to give you their opinion. If you ask friends, they're going to give you their opinion. Everybody has an opinion. And sometimes people have things because they believe that it is cleaner, less infection, avoid HIV, won't get cervical cancer, it looks better, all of these things, okay? And the whole cervical cancer and HIV and all of that is debunked, okay? That has no bearing anymore. So one has to say to oneself, if this has been done for generations in my family, why should I continue this tradition? Is this in the best interest of my child, and would the child ask me to have a surgeon remove the foreskin from their body? That's a big question, isn't it? That's why I said this is a really hot topic, and it comes with a lot of emotion from whoever it is. Okay? It doesn't matter which parent you are and what gender you are. There's a lot of emotion involved in this one. All right, let me see what a couple of the comments that are coming in. We didn't put gauze on our son in 2015. They just had us put Vaseline to keep it from sticking to the diaper. I let my husband decide. He was in favor because his father, who is a doctor, thinks that it's cleaner and prevents infection. Okay, those are probably some of the most common things that we will talk about. Either they are to look like their parent, they have parents that tell them that this is what they should do, and it's not it's not always the best reasons to do it. You really, really need to research why you want to remove a part of your baby's body that is functioning and serving a purpose, and that nothing's wrong. And usually it comes with, most of the time, it's an emotional thing that they're doing it. Either that they want them to look like somebody in the family, right? Or they don't like the look of an uncircumcised penis. And what I say to that is that in our country, we're not used to that. We're not used to seeing it covered and not showing, okay? So you really have to ask yourself, all right? Now, I will go over a little story here in a minute. Let's see what came up. My OB told me it was purely cosmetic. I didn't believe in cosmetic surgery for a baby. First baby not circumcised in our families. Right on. Okay, good job. That's the same way, is that, you know, families can make a different decision and the tradition can stop right there. So thanks to the obstetrician who was honest with you and said it's cosmetic surgery, which it is. Now, like I said, the only time that it is reasonable is when there's something wrong. And some will say, oh, well, my uncle had a circumcision when after, you know, he was in his 50s. And I'm like, okay, you know, we have surgeries when something goes amiss. And at 50 or at 30, if something goes wrong, then you have it taken care of. So let's look at if a partner, I'll call it a dad, a male parent, was had one leg shorter than the other, would you have the baby cosmetically changed so it looked like the parent? If a parent had an ear that was deformed, would you have the baby cosmetically changed so that it looked like the parent? Yeah, I know. They're kind of wild things. You go, well, no. If the baby had a heart defect, would you have surgery? Yeah, if it was going to benefit the baby's health and well-being, you would have the surgery because something's not right. So that's part of what one has to ask. So the basics behind looking at keeping intact or circumcising is it does come with a lot of emotional charge. And we sometimes feel like if we did one child because maybe we didn't know, or maybe, you know, somebody said that's what we should do, and now we're having another child, and you think, well, I've already done one, how can I not do the other? They'll feel bad, la-da-la-da-la-da. All right, no two children are the same. Even if they come at the same time in the womb, twins are not the same. Now, a total identical twin, a lot the same. But their spirits aren't, their personalities aren't, and they shouldn't be treated the same. And anybody who's had twins knows that. So, when we look at having had one child that was circumcised, you don't have to make that decision for another child. You make a different decision based on knowledge and based on your parental wisdom And you think, but how am I going to talk to them? You talk to them. You talk to them when they get old enough, and you tell them, because they will eventually ask why they look different. And you say to them, let me sit down and tell you. There is a foreskin, there's a piece of skin that's covering this. When you were a baby, I didn't understand that that skin was something that you might have needed, and we had it removed. But we knew better when your brother came, so we did not. And sometimes you have to apologize and say, I'm sorry that I didn't know that, but thank you for helping me learn so that I could do things differently with some of my other children. Now, sometimes you start running into people who watch your child if you have an intact baby, and you do have to be careful with that, because I have not only seen pediatricians retract foreskins and cause bleeding, and that can cause scarring because they think that's what they're supposed to do, or they think that's the right job. And I've also seen grandparents or aunties or someone who is taking care of a child that will pull it back, sometimes out of curiosity because they've never seen a foreskin like that, sometimes because they think they're supposed to. So if you keep a baby boy intact, please be clear with your instructions to doctors, if you go into an emergency room, or with people who might be changing diapers, as to how to care for this so that they don't hurt your baby, so that they don't do something that would be uncomfortable to you as well. All right, send me some more. Here comes another one. As you know, we didn't circumcise our second because I decided if he needed the surgery, we would wait until he actually needed it. And if he wanted it when he was older, he could get it done, but it could never be undone, and I wanted him to be able to decide for himself. That is a great condensed way of putting the whole thing, Cassie. Thank you. Now, questions about things. And as I said, this is an emotional, hot topic. Every time we've had to sit down with a family who knows they're having a boy, or who doesn't know, and they need to discuss it, sometimes we have parents who are very open and wanting to learn and wanting to gain information, and sometimes we have a parent who's like this: we're doing it and I don't want to hear about it. And I think that's really not fair. It's not fair to the birth giver, who may not want to do this to the child. It's not fair to the child for any parent to be closed-minded. You need to listen, you need to learn, you need to go and research, and you need to understand what you are doing if you're choosing to do surgery, which seems so minor. But I'm telling you, if as a grown male we laid you down, strapped your arms and your legs to a board, okay, and told you that we were going to cut you, I dare say you would have run the other direction as fast as you could. And you would never have let anyone hurt you or a child that was older. All right, got more comments coming in. Let me read them. Ooh, you guys are good. Let's see, where are we? If someone asks, we have a son, we will just say, we aren't going to discuss our son's penis with anyone but him. I love that. That's great. Could a boy get circumcised at an older age if he wanted to, but parents chose not to? Is there a cutoff age? Cutoff, that's cute. That's a really good question, actually. Let's say that there was a boy who was 10 years old and he said, I want to get circumcised. He wanted that done. The parents would have to decide if the child, if there was a reason for it. But, you know, isn't it interesting that as an infant doesn't have a voice, but when a child is old enough to have a voice, would they allow them to have that done? I dare say, because it is a circumcision, that it's highly possible that the parents could opt to do it, especially if the child wasn't against it. But it's a very interesting question. I don't know if there's a cutoff. That's a really good one. I like that one. We're gonna have to find out. Do you have any resources, books, articles I could send my husband? I so appreciate you speaking on this topic. All right. So part of the reason I speak on this topic is because I, have them tune in and listen, right? The other thing is there are sites out there. There's nocirc.com. That one is probably the easiest one to go on. And they have a ton of resources. And realize that anytime you go looking for something to help substantiate that you want to keep them intact, that's what you're going to find, right? If you say, why should we circumcise? And I sometimes think you just, and the reason I tell you nocirc.com is it's the easiest one that's out there, but there's several others that are very good with that, and not hard to find, not at all, okay? But books, yes. They're like Gone with the Wind. But I will try and post some for you because I don't have them in my head right now. But part of the reason that I talk about this is because I would say all of the birth givers, the women, have not wanted to circumcise their sons, except one that I had. It's always been, I'll leave it up to my husband, or he's really insistent on it, or we're having a lot of discussion about it. And sometimes I say the best thing to do is say to them, I'm not feeling comfortable with the decision to circumcise our son right now, so I'd like to just keep that open, that discussion open. And I would really like to listen to you and ask you why. Why? What is the reasons that you want to do it? And do you have more than just an emotional hook to it? And many times it's because somebody teased them, okay? And it used to be that we had locker rooms all the time. Now you don't have locker rooms hardly at all in the younger schools. But the other thing too is that on this side of the United States, the intact baby boys are going up, okay? Because insurance, or they're not doing it at the birth or while you're still in the hospital. Certainly home birth midwives and birth centers are not doing them. So you have to make a special appointment to actually go in and have it done. So I think sometimes to be able to say to a partner, I hear you, I'm listening to you, and I want you to listen to me, and let's keep this discussion open until after the baby's born. And once we've had a chance to look at him and really have a discussion again about rather we want to cosmetically change him, let's just be open to that discussion for a little while. Now, it may be that partners are still not talking about it, we're doing it. And that's fine. You just say, well, I want to keep the discussion open. My dad was done before him, all my brothers are, all my cousins are, and I don't want him to look different. And I think the best thing that you can do is just say, I hear you, and I want to just keep this discussion open, and I want you to understand my side of it as well. Because as a birth giver, you rarely want to have your child undergo something unless it's necessary, right? Okay. I'm running out of liquid. I'm going to have to go get more. All right. While I do, are there more questions? Oh, yep, there are. Okay. I'm going to take my mic off one quick second. Hang in there with me. Don't go anywhere. Take a quick drink. Right back. Okay. Let's get Mike back on. Inside. Okay, let's see. My husband comments are when people say it's so much worse when they're older. Why? Because they can communicate with you how terrible it is. Why is the assumption newborns don't feel some pain? Okay, so yes, that's another topic of discussion with it, because they're like, well, I don't want them to have to undergo it when they're older because it's so much harder. So part of the harderness happens to be, one, they're far more aware, they're more physically developed, and should they have an erection when that foreskin has been taken off that a male could have because of now stimulation and things like that, that can be a challenge for them, okay? But I think a lot of it does have to do with the pain and the discomfort that goes along with it and the consciousness of what's going on. So they think, well, let's just handle it when they're that little and then things will take care of. So here's a question too that I think you could ask anybody, is to say, who started this? Because if you and your dad and your grandparent and etc., who started this and why did they start it? And that one's a tricky question, because I think that most people who are for it would have a hard time answering that one, with the exception of looking at biblical, right? And so when they start looking at biblical, that's a whole different discussion because of religion. Now we know in the Orthodox Jewish, the baby boys are circumcised. It's a religious rite. It comes in with their philosophy. Muslims, we know that there are religious reasons why baby boys are circumcised from those beginning times and days and ages. And that has carried through the history and continues today. Do I still agree that it's okay to do it? I'm not going to answer that. What I do know is that if you ask why did they start it in the beginning, you're going to go back that far to find it, okay? And coming forward in time, there was a lot of things that brought that philosophy that said all of them should be done so that they can decide who they are in tribes and etc. It had a lot to do with rite of passages in early years. So there is history behind that had to do with society, not with what's going on in the baby boy's body at all. It wasn't benefiting them as far as how their body functions. Not at all. We also know that there are countries that circumcise girls. And that is to stop masturbation, take away pleasure, make sure that they are saved only for their husbands so that they don't have sex early. And there are people trying not to let that happen anymore because it's called what? Female genital mutilation, right? And so we don't call it that in our country. We don't call it male genital mutilation. We don't call it amputation. But that's what it is. But it sounds softer to say circumcision because we're used to that word, right? All right, let's see what else we got. Oh, I got some more waves here. There's one. Okay, let's see. My two cousins who were uncircumcised got terrible infections at around 8 and 10 and had to get circumcised due to infections, but they hated every moment of it. Two different parents. Okay, the question comes into, why did they get infections? I'm always one that says, here's the problem. Let's follow it back till we find where it started. And when you look at that, when they're not circumcised, they should not be forcibly retracted. And They have to be taught normal cleanliness, but to be 8 and 10 and have infections and they chose to circumcise them, I'm like, wait a minute. You can clean those things up, and to get an infection that bad in it, what was going on in the life? What was happening? What were they allowing to allow that to get that infected with it? So that's the question that has to be asked, is how did that occur? Because it's unusual in 2 different families to get an infection and to have that done. Now, here's a question I will put out, because sometimes they have a reason to want to have it done. And what the severity of it may or may not be to the degree that it sounds. That could be. I've seen that before, where some said, well, they got a little infection, and so they decided it was best to take it off. Well, it didn't open quite as well as it should have, so they said, let's take it off. And I don't know whether that's really the child's preference, that's the parent's preference, but infection usually does not happen unless they're pulling on it, sticking things into it, not cleaning it well enough by taking baths or showers every day, not being told to pull it back, pee, and then rinse, and being able to know how to do normal care. So that's a good question. But I always say follow it backwards. Also, nurses saying so many old men stop taking care of themselves and they're awful in the ED. How to respond? Yeah, well, women get smelly and they get yeast infections, and things occur for whether they're males or females. And so much of it has to do with just normal hygiene. If you come up against somebody who has bad breath, are they brushing their teeth every day? Are they flossing? Maybe they need to have some hydrogen peroxide and water, rinse once a day or every couple of days in order to keep the bacteria down in their mouth. The same thing happens in the other areas of our body, under our pits, right? In our bottoms. And when you think about all that goes on in our bottoms, from the poop that we do, the pee that we do, going swimming, going in a lake, any of these types of things, there are certain common hygienes that have to be taken care of. But as far as elderly people, they have to be cared for. They have to remember that those things have to be done. And if they're not doing well mentally, then they need some help and reminders with that. It doesn't mean that you go and you have them circumcised as a newborn so that as an old man, they don't get smelly and stinky. That's just, they have to take care of themselves. So how do you respond? Nurses saying so many old men stop taking care of themselves. Yeah, that's a good one. Awful meaning infections and smelly to clarify the above. Yeah. And it really comes to the fact that there has to be good hygiene. There just has to be good hygiene. And it doesn't mean that if they were non-circumcised that they were ever taught good hygiene, or they just stop caring, like you say. And they have to be supported with that. Maybe that's why baths were good rather than even showers. And sometimes in hospital settings or nursing homes, they don't take baths. They take showers only, and they do have to be cleaned. And other people sometimes have to take care of that. So I do get that that's something that's got to be watched. Let's see, where are we at? Yeah, fire off your questions. I'll do my best. Oh, I know one. One of them is when you say, well, I don't have a penis, so I don't really know, so I am going to leave it up to my husband, or I guess since he has one, then he knows what that's like. No, he only knows what it's like, what he is. Just remember that. And you, as a 50-50 parent, need to put your 2 cents worth in. We have a boy coming, and I'm really leaning towards not circumcising. My only hang-up really is my husband. Said the guys in high school and college were teasing relentlessly. I would feel so bad. All right, so here's a little story. My midwifery partner, Marlene, she has had children, and she has had 5 boys. 3 were circumcised and 2 were not. When the younger ones, who were not, went to school, they came home and they said, why do we look different? So she sat down and explained to them what was different and what she chose to do and things that she did not make the same decisions about her older children, and she apologized to them. And what they said to her was, thanks, Mom. Thanks for not doing that to me. All right, I think that the other thing is this teasing issue comes from people who feel insecure. And I think often I have to wonder if the partners who are worried about the teasing, were they the teasers? I don't know. You know, it looks different. On a grown male, an intact foreskin looks different. It covers the glands, and it does have a length of skin to it. It looks different than an erect male or than a male who has been circumcised. And it's like if you were to drive by and see the horses. You see that kind of pink reddish, you know, it comes out of that foreskin, and you say, hey, put that back in. So you have to be able to look at this whole teasing thing and realize that, is that a good reason to be able to say, as a newborn, you're going to cosmetically alter something that's functioning and has a purpose? It's still the baby's choice. That's really one thing you have to look at. Okay, let's go over to Facebook here. I'm thankful that my husband was open to learning about it. My now 13, 11, and 6-year-old boys, my goodness, 13, are intact. We've never had any serious issues. Right on. With my son, my first, I circumcised because I wasn't informed on how bad it was and how it was done. But with my second, I wasn't going to circumcise because I was informed. But I ended up having a girl. I feel so bad I put my baby boy through that. So that's one thing that I do want to say to you parents, and especially talking about this topic, I want to say thank you for being here, because sometimes that's really hard when you did circumcise and now you're looking at this, and you just have to let go of the guilt, let go of the regret, and be able to say, I didn't know and didn't understand at that time. But now I'm learning, and now I will have a voice for baby boys. I will say to parents, you know, I know you're thinking of circumcising, and you know, I was watching this live and they mentioned some of these things, and I just thought, you know, sometimes we have to ask ourselves why we're doing it, and where did it start, and why do we really want to change them? And I just really think it's important for parents to really make educated decisions. But I'm all about educated decisions. Okay, let's see what else is on here. You can't blame yourself for that. You did the best you could at the time. Amen. I let my husband decide. I made him watch videos. He is circumcised, and he decided against it for our son. I have had families do that. They were adamant about it. Then they went. You can see them on YouTube. You can see them all over the place. They went and watched a circumcision. And you know, I do think sometimes you have to do that. I had a mom who was very upset with me, the only one that the mom really, really wanted the circumcision. And I said, will you please watch this video? And it was about the information, and it did have a circumcision in it. She was very upset with me that I made her watch one. And so I said, well, I'm sorry. I wanted to make sure that you had the information, and you know, let's make sure that everything goes well. because it ultimately is you as the parent's decision. It's not mine, but it is my important as a midwife that I'm a good educator to be able to help parents know what those choices and decisions are that they can make. And then when they decide that, do the best at helping them have some homeopathy, making sure that things go well, they get to somebody that can do it well, and know that it's still not my choice. But right now I'm hoping to give all of you more wisdom and insight so that you can, not only for yourself, but for others, hopefully help people understand that they do have choices. All right, let's see what else we got going here. Thank you. I just felt bad when I saw a video of it and I couldn't believe it. Yeah, I know. That is really hard when you circumcised a son and then you watch a video and realize that that's what your son went through. My older son was circumcised because I was 19, didn't know better. 16 years later, we were pregnant with a boy. We were blessed to have you. And Marlene, tell us to watch the Penn and Teller video. Okay, so just so you know, Heather, I can't watch the Penn and Teller video because they get really raunchy. And it's just how they present things. But Marlene loves that one. We didn't even finish it before we both decided, no way. Thank you so much. Well, you're welcome, Heather, and I'm glad. All right, let's see who else. We have a boy coming, and I'm really oh, that was you? Okay, good. We're doing well. Let's keep going. If it is a medical necessity to remove the foreskin at birth, is it important to get the vitamin K shot because the baby can't clot yet, or so I've been told? So, you know, if the circumcision is going to be done within a couple of days after birth, it probably is a good idea because they really are not manufacturing enough vitamin K until they're closer to a week old, till that good breast milk and everything is getting in their gut and their gut is growing and that bacteria is growing in there and they're starting to produce that vitamin K. So yes, I think that a vitamin K would be important if you're going to have surgery. And a baby who's having circumcision is having surgery. We did have one baby who we didn't know they were going to go have the baby circumcised. This was many years ago, and they called us up after they had been there and came home. And they said, you know, how much blood is normal after a circumcision? And we said, well, tell us what you're seeing. And they said, well, the diaper's pretty full of blood. And at that time, we didn't have camera cell phones. And we said, if it's full of blood, you need to take him back immediately. And that baby ended up having a transfusion because they cut the glands and he bled out. So, you know, and I know that's one of those big horror stories, you know, that people say, oh, well, that only happens once in the blue moon. It happens more often than you think. Bent erections happen because skin gets formed and heals in certain ways that doesn't always allow that erection to be straight. I just go back to if it's not broken, don't try and fix it, right? But I do realize it's a big conversation that happens in a relationship, and you really do need to look and see. Now, like I said, YouTube has plenty on it. You can go to nocirc.com. They have videos. They have tons of research information, etc. So, all right. So yes, I would probably do the vitamin K. I didn't know my husband wasn't circ the first time. Oh, he was erect and looked normal. Right. Good job. Good comment. 3 of my boys are circed and 2 are not. Right on. Good for you. I'm having a C-section but no circumcision. You are doing a fabulous job of being able to know that you're giving birth to your baby. And when that baby is born, that you're going to save that baby from having surgery itself. And you are going to scoop this baby up as quick as it can get back to you. You're going to tuck it in your shirt. You're going to smell it and kiss it. And you're going to put that baby to breast. And you're going to stroke this little baby and just envelop this baby into your heart, your mind, and your soul. Okay? I wish more OBGYNs would educate on both sides. Wishing we had a midwife for our first pregnancy. Why are most docs for circumcision, or so it seems? Well, I think there's a couple of things. One, probably many of them are circumcised. Second, many of them do circumcisions, and it's kind of what they do. Doctors are very good at surgery, drugs, and testing, right? And the other thing that I think is that they have opinions. They have their own opinions of things. And so as their opinions go, then they pass those along. But it's like birth, midwives have the ability to say, okay, this is what we do. This is what our care offers. And you always have an option to go to a hospital if you want to go to an OBGYN. But you won't find an OBGYN very often who says to you, are you sure you want to come to me? You don't really need to. I mean, how many times have we heard that? Never. You don't really need to. You're not high risk or anything. Why don't you go to the midwives instead? You won't hear that. All right. I know. I would do oral vitamin K as well. I probably would not give mine the injection as well. I don't know if a doc would do the circumcision without an injection. That's a good question. I also would like to say to you, if you ever have somebody that maybe they've learned about all of this, but they're still planning to do it, one thing that I suggest is don't equate it with the birth. Let the baby get here, let it get adjusted to the world, let it get its milk in, let it start gaining weight, get over all the jaundice, and do it during the middle to the latter part of the second week. And doing that gives the baby a chance to at least land here and not have that part of the beginning of their life. Now, Marlene talks about the fact that circumcision is where sex and violence meet at the same time. That's huge. That's another big charge that goes into us, especially when we have, some that are and some that are not. Some we did, we wish we hadn't, and etc. And, that part of it has to be let go of. And we have to have good, encouraging relationships into these kids as they grow up, okay? Yeah, but I like you. I like the drops. I don't like the injectables. But actually vitamin K and not the one in the hospital, right? Because the vitamin K shot is also a vaccine concoction with more than just vitamin K, yeah, which we chatted about. Yes, vitamin K is not just vitamin K, it's a concoction of ingredients. Yeah, and many say it's not the vitamin K that's in it, it's all the stuff that's in it. What would you say to the comment, I was circumcised and I'm fine, I'm not traumatized and don't remember it? Well, there's discussion on that as to how much do we remember when we are young, when we are a newborn, just like, do we remember our births? What does it matter? Do we remember getting an IV or going through being suctioned at birth or being resuscitated? There's a lot in perinatal psychology that we gain understanding that more is in our memory bank. And even if it is not a conscious memory like I ate chicken for dinner or I had an apple for a snack, it's in cellular memory. Now, as a body worker, all right, because I do, babies, I do infants body work. When I work on a baby, I can feel direct ways that their body has patterned if they've been circumcised. So for me, that's something that I can feel on a physical level in them because of the way that they handle their body. So let's look at this as trauma. Now, a newborn, when they have trauma, what happens in the brain, and you've heard me talk about this system in the brain that says when there's a trauma, we touch something hot or whatever. Let me look and see what our clock's doing. Uh-oh, our clocks, are we gonna go off? Oh, I'm gonna lose all of you on Facebook here and on Instagram. That is going to be for another